and we can share it with everybody. So that gives you some background. And without any further ado, I'd like to introduce the leader on our side for youth programming, and that's Ms. Catherine Malone from Union Achievement. So, Catherine, the microphone is yours.
Gary, thank you so much, and good morning, everyone. Thank you so much for being with us today to discuss a very important topic. My name is Catherine Malone. I'm the chair of the Shared Youth Vision Council for New Jersey State Employment and Training Commission. And I have the absolute honor and pleasure to introduce to you Kyrie Robinson, who is going to kick us off and will be introducing our first speaker. Kyrie?
Thank you so much, Catherine. I really appreciate you. And thank you so much for being such a wonderful and dedicated and conscientious chair to our Share Youth Vision Council. Today, I just want to thank everyone for coming on to our Share Youth Vision Council webinar on youth homelessness. This is just not an event. This is really a purpose, and this is really something that we are really trying to make a difference in. If you can, everyone on the line, if you're not talking, go ahead and just place yourself on mute just really quickly. That sounds like I hear somebody. Thank you so much. And I just wanted to just start with this quote before we introduce our first speaker on today. I just wanted to say, it does not matter how slowly you go, as long as you do not stop. Never give up, but that is just the place and time that the tide will turn. You just can't beat the person who won't give up. There is no failure except in no longer trying. And that was by James W. Jenkins. And I just wanted to say, as you all know, we are here for youth homelessness. And we know, according to federal facts and statistics, that 29% of homeless families are headed by a working adult, usually the mother. More than half of homeless mothers do not have a high school diploma. Approximately 63% of homeless women have been victims of domestic violence. Subsequently, homeless children are more likely to suffer from hunger, poor physical and emotional health, which is less likely to attend school and more likely to fall behind in class. While the number of homeless children in America is estimated at 1.6 million, many estimates suggest the number could be far higher, as homelessness statistics are often underreported at the city, county, and state levels. Homeless youth experience 4 times as many infections, twice as many sicknesses, and 4 times as many deadly illnesses. But the most important number is one caring person, and we have a whole lot of those on the call today. One caring person takes action and helps one homeless child get off the street forever. That's the difference you can make today. Ladies and gentlemen, with no further ado, I want to go ahead and introduce our speaker, one of our youth speakers. And I just love this because youth speakers are very, very important, and they actually just provide so much insight that some of us who serve the youth sometimes may overlook or may not notice or may not see. So sometimes just hearing it straight from them is just, it really is a blessing. So at this time, we're going to go ahead and call for Tayaba, who's going to be coming forward with her perspective. Thank you so much, Dom. I'm not sure if she's having some technical difficulties. She is on, but we cannot hear her. What we're going to do is I'm going to give her a few seconds to get herself together. She is on the call, but for some reason, maybe she's having some technical difficulties. So in the meantime, we're going to go ahead and switch over to and kind of transition a little bit slightly into our next speaker.
I'll go back to some of the questions that we had, and that way you can maybe give Tayaba a call and see if we can help straighten that out. How's that sound?
All right. That's perfect.
Um, one of the things through our discussions and research that we found is you can find, in a sense, we have a concept of what homelessness is, but definitions differ from agency to agency and organization to organization. So one of the things we did is look at defining homelessness. You can see in front of you on the screen, and we're going to do some things like this throughout the morning. If you want, you can do this in the chat box. If not, you can just think about it. But in defining homelessness, we found these different groups of things and definitions. So, excuse me, from my left, the first you see, homelessness defined as individuals who lack a fixed, regular, and adequate, excuse me, nighttime residence. In the middle, homelessness is defined as people who are living in a place not meant for human habitation and people who are losing their primary nighttime residence. And then on the end, another definition is a shelter or other facility to provide temporary living accommodations to individuals who lack a fixed, regular, and adequate residence. Anyone hazard a guess where each of those definitions come from? There's no grading. Okay, so let's look at that. The first one is the U.S. Department of Education. Next is the Federal Office of Housing and Urban Development. And the last, state of Texas. What you find is that some states rely on federal definitions, some states have specific definitions, and then on top of that, some states haven't defined it at all, and they just rely on the federal government to have programming for those who are homeless. Let's move ahead a little while Kyrie's working on it. One down. So, who are we? We're the State Employment and Training Commission. I'm Gary Altman, its director. It's New Jersey State Workforce Board. We work through a committee structure, one committee of which is youth. We have groups on governance, literacy, and performance. And one of our major approaches is to act as you can see there, a convener or a table where multiple actors within one area may work collaboratively in approaching different issues that affect the economy, employment, and the individuals we all work with. Why are we here today? Well, homelessness affects people of all ages and includes the young. Colleagues who have worked in the homelessness field shared a need through our meetings to connect workforce-related staff with homeless youth because, and it's going to sound obvious, not only do the young people perhaps need a job, but their families may need that as well. And in the short amount of time people may have to work with individuals, we hope to make that connection and to hope to improve opportunities by making that education workforce development connection. The need extends beyond the youth, as we just said, and we also recognize that the needs of homelessness expand far beyond what we're approaching today. There are social issues, economic, things considered like teen pregnancy, mental health, addiction, but we know this is one part of it, and maybe, by improving relations in our corner of the world, we can help take a little bit of that away and assist more people. I'm an old rock and roll fan, and this kind of summarized the approach. It's George Harrison's birthday week, so we used a quote from him. And this kind of symbolizes the discussion we had within our group when we were looking at all these complicated parts of homelessness. And one of our speakers later, Alan Ferraro, said simply, help us get people jobs. And that switched the whole focus, changed the whole tenor of our discussions. And that's why we're here today. This is about establishing or improving relationships between those programs that are going on in schools and the workforce development system, so that when an individual and his or their family needs help, there's someone to call, someone who's part of the community, someone who may understand where the needs are, and someone who knows where the jobs are. So, we have many thanks for Alan, aside from giving him time to educate us all today as well. So thank you, Alan. Who's joining us? In addition to Alan, we have Marnock Housing. Excuse me. Not only provide housing assistance, but if anyone's ever been aware of the point in time count that goes on in New Jersey, that's how homelessness is counted in New Jersey. They're the organization that does it. Education. Alan will be joining us, as I mentioned, to talk about homeless staff that works within the schools in New Jersey. And then we're going to be joined by Mr. Kevin Kurtzel. Kevin is going to talk about not only his local system, he's the CEO of the Workforce Development Board of Middlesex County. He's also the president of the Garden State Employment and Training Association, which represents all of the workforce development groups in New Jersey. So, excuse me, our hope is that you can connect to many of those through Kevin. Pardon me. So, with that, Gary, you want to bring Caitlin on?
Yes, Gary. I actually have our original youth speaker on the line. She was having a little bit of technical difficulties, but I wanted to still bring her on.
There we go.
I just wanted to stay in order. And we all know our internet, everything goes crazy, guys. But I had already given an introduction. I just wanted to say this quote because this just reminds me of you again. I already said it to the group, but it just means a lot to me. It says, "It does not matter how slowly you go, as long as you do not stop. Never give up, for that is just the place and time that the tide will turn. You just can't beat the person who won't give up. There is no failure except in no longer trying." And I just think that just ties in not only to Don, but we have a few college students who make up a great percentage. If you do the research on a lot of homelessness in the state of New Jersey, several different universities and colleges on the line. So I just feel like in that demographic, there are a lot of things against you. So for you to persevere, that says a lot. And with no further ado, Dom, we're so appreciative of you. Thank you so much for what you're doing right now. Dom?
Hi. So, I'm Dom Ahmed, as you know. I'm 18. I'm currently staying at Covenant House. I've struggled with homelessness in the past, and I'm currently getting out of it. So, I was kicked out of my parents' house shortly after my 18th birthday, and one of my friends took me in essentially, and I was couch hopping for a couple of weeks, but I got in touch with a program called Visions and Pathways that's located in Somerset County, and they did provide me housing for a good 7 months until I was unfortunately kicked out of that program because of some mental health issues I was having. But then I went to Covenant House, which is where I'm staying at now, and I've had a lot of resources presented to me, like NJ211, case managers through the state, and also Rutgers UBHC has helped me a lot. But basically, I got in touch with the Reformed Church of Highland Park, and they are currently helping me. They're currently housing me. I'm expected to move in within a week or so. So I'm glad that I could get out of that situation, and I learned a lot from it. And no matter how much you're struggling at the moment, there will always be a light at the end of the tunnel. There's always going to be some positive, and there's always resources to help you.
Dom, thank you so much. Did you have anything else you wanted to say? We really appreciate you.
I think I'm pretty much good.
Okay. Well, I want to thank you. That took a lot of courage and that took a lot of determination to do that. That's not easy to talk in front of 60 to 70 strangers so you never met before and be vulnerable like that. So I just want to thank you again just for sharing, just giving us that. I really appreciate you. Thank you
Thank you
again.
for
At this
having me.
time, yes, thank you so much, Dom. We appreciate you. You are our future. And if the audience doesn't know, Dom wants to be an engineer. So please look out for her. She is, I say she is amazing. I'm not just saying it because she's our speaker. She is really amazing. She has been given lemons and she made a whole batch of strawberry lemonade, not regular lemonade, the strawberry kind. So Dom, we thank you. At this time, and in transition, our next speaker, Miss Caitlin. I'm just so thankful for you. We have a wonderful representative, one who is involved in the community, one who cares, one who loves the people that she serves in the youth of our state. She's representing Monarch Housing. We will have our presentation at this point from Ms. Caitlin Ravensbergen from Cranford, New Jersey. Ms. Caitlin, we want to thank you again, and we want to go ahead and give you this platform for our youth homelessness webinar.
Good morning. Thanks, Kyrie. I just want to make sure you guys can hear me, right?
We can hear you.
Awesome.
Yes, we can.
Thank you, thank you. So as Kyrie said, I'm Caitlin Ravensbergen from Monarch Housing Associates. I'm just going to go through hopefully a brief presentation, just a little bit of background on Monarch, some of the work that we do around point in time count, and then I just want to get into some overview of continuums of care and services that are available for persons who are experiencing homelessness throughout the state of New Jersey. So next slide. So Monarch is a nonprofit organization, and our mission is to expand the supply, accessibility, and variety of affordable permanent supportive housing. And we really do that through three avenues of work, and that's housing production, advocacy, and then homeless planning, which is the team that I am on. And I would say most of you, if you've had experience with Monarch, it's probably through the homeless planning team. Next slide. So on the homeless planning team, we are a consulting agency that works with the counties and continuums of care, which I will get into a little bit more detail in the next slide or the next few slides. And on homeless planning, on evaluating systems, evaluating programs, making sure that they're functioning, and then largely helping to accept funding related to homeless planning. So some of the key areas that we work on is continuum of care applications themselves. So continuum of care, just to note, there's two parts to it. There's the funding that comes from the U.S. Department of Housing and Urban Development, which is the application that we're referencing here. And then there's the local continuum of care, which are the actual planning bodies responsible for carrying out, program evaluation and things like that, making sure that systems are working. So we help prepare COC applications for funding, provide technical assistance. We then do system planning. So we oversee and facilitate continuum of care meetings, prepare strategic plans to end homelessness among the different counties and COCs throughout the state. We monitor system performance, review system processes. We also advise on restructuring and strengthening the system. Through some data analysis, we do coordinate the statewide point in time count that was mentioned earlier, and I have a slide on that next. We prepare statewide HMIS data analysis, and in case anyone doesn't know, HMIS stands for Homeless Management Information System. So anyone who receives funding from HUD, the U.S. Department of Housing and Urban Development, a lot of state funding tied to homeless services, they need to enter information into HMIS. Just shows the clients that they're serving, what services they're providing, were they connected to income resources, all of that, so that we're able to see some system outcomes. And then we work to develop analysis templates for local planning. The last kind of category that we work on is innovative program development. So we assist communities in developing and implementing coordinated assessments, housing first projects, FUSE programs, which are frequent user programs. We work with agencies on individual program development, and we also provide technical assistance to improve program performance. So I will say Monarch's role, we do not do any direct, we don't like any direct client work. We don't provide any housing specifically. We are more so one level up, trying to work with the developers. We're working with the programs in order to make sure that they're doing everything they need to continue to get the funding, that we're doing strategic planning to make sure that our systems are working as best as possible. Next slide. So point in time count, in case anyone doesn't know, what is the point in time count? So point in time count is a count of persons experiencing homelessness in a given area on a single night. It is inclusive of sheltered and unsheltered homelessness, and it has to be conducted during the last week of January. That is part of the HUD requirement. So the point in time count actually just happened. What is it now? A couple weeks ago, at the end of January. So for 2023, the primary activities for the PIT count took place on Wednesday, January 25th, asking where people stayed the night of January 24th. And so really the overall goal of the point in time count is to be able to say on any given night within a county or within a COC, this is how many people are experiencing homelessness. And this is, in some COCs, really the only good way to say how many people are experiencing unsheltered homelessness, because sometimes it's difficult to know how many people might be on the street at any given point. So there's a big outreach that's done, and all of that is planned locally. So Monarch's role in the point in time count is we help put the survey together. We do training for any volunteers who are going to be doing the training, the surveys, and then we actually do the data analysis and release the reports for it. But each county runs their point in time count efforts a little bit differently. So some of you might have heard from some COCs or counties when they're working on their point in time counts and helping to fill out surveys, collect donations, things like that. I did see a question in the chat. So what is significant about the last week of January? There's definitely some debate on why January, especially in states like ours where it gets quite cold, right? And things are a little bit more difficult to organize at the end of January than it would be in the summer. But HUD has said essentially that clients who are experiencing homelessness in January are our true homeless, and that's who we want to make sure that we have a count of, right? So usually in wintertime, or sometimes in the wintertime, families might be more willing to accept clients in, let them stay with them, whereas in the summer they might not. And so those that we're counting in January give us the truest sense of who's experiencing homelessness. That is why the end of January. And then why do we do the point in time count? Like I said, it is a HUD requirement for COC funding, but it is also a way to gather data for local planning purposes so we can better understand who is homeless, where are they finding shelter or not finding shelter. This is especially important when it comes to things like code blue. In case anyone doesn't know, when it reaches 32 degrees or below, a municipality or a county is required to call a code blue, which just means that there should be an additional emergency shelter opportunity available in that municipality throughout the night. So each county has their own centers and rules around code blue. But municipalities that are required to participate in the code blue planning comes based on the point in time count numbers. Factors contributing to homelessness in the community and what services are needed. Next slide, please. So I just want to pivot a little bit into what is a continuum of care, and then different roles of some of the program opportunities that are available for any families or individuals that you guys might be working with that are experiencing homelessness. So in case you don't know, each county has a connection to a continuum of care throughout New Jersey, right? So a continuum of care, like I said, is a community planning body that's charged with organizing and delivering housing and services to meet the specific needs of people who are homeless as they move to stable housing. So there's continuum of care, the funding, and then there's continuum of care, the community planning body. And every county is associated with a COC. COCs are made up of local governments, nonprofits, persons who either are currently experiencing homelessness or formerly experiencing homelessness, hospitals, business partners, law enforcement, and advocates. And I will say each COC looks a little bit different depending on who's kind of taking the lead there, but generally that is the structure. Next slide. As far as the role of the continuum of care, the real goal of all COCs in the planning body is taking a look at the system and making sure that it's working, right? So that includes assessing the need, how many, and that's where point in time count comes in. How many clients are we serving? How many clients are we not serving, right? Are falling through the gaps in our system. Developing and implementing strategies to work to end homelessness, applying for funding, creating strategic partnerships, structuring an effective system, and then monitoring system performance. And I will say, while the COC was developed because of this one stream of funding through HUD, the continuum of care goal is to really look at all funding sources that are providing programs for people who are experiencing homelessness. So it's not just focused on COC funding, it's focused on other federal funds like emergency solution grants, and then local funds. There's a lot of funding that comes from the state that's tied to serving persons experiencing homelessness or those at risk of homelessness. Next slide. So as far as the continuums of care in New Jersey, so for the most part, each county has its own continuum of care. There are two merged continuums or regional continuums. And I'm sorry for this map. I outlined these myself using my mouse on my computer, so the lines are a little janky, but Warren, Hunterdon, and Sussex work together to do regional planning related to the continuum of care, and then Camden, Gloucester, Cumberland, and Cape May, the Southern New Jersey COC, work together to do their regional planning. So each county still has, allocations of state funds and still has a local planning body, but those groups of counties really come together to say, hey, we know there's a lot of crossover between the clients that we're serving, and so how do we create a system, as a whole, as opposed to by county. The rest of the counties that are not highlighted run their own COC, basically. Next slide. So the next thing I wanted to just briefly go over was some of the programs that make up a homeless service system, right? So if you're working with someone who's experiencing homelessness, there is probably a lot of jargon program types thrown about and different options of programs that they might be able to access. So I just wanted to quickly go through what are the different programs that make up a homeless service system. So first is outreach and engagement. And so that's targeted to persons who are experiencing unsheltered homelessness, who are sleeping outside, who don't have any connection to other agencies. It's teams that go out, try to let them know what services are available, try to get them connected to, let's say, Board of Social Services for income, obviously emergency shelter, things like that. So they're really the street team, kind of the front door. Centralized and coordinated intake is a streamlined process that basically fields requests for assistance and helps identify most appropriate program. I will get into more detail on coordinated entry in the next slide. Prevention is providing limited financial assistance for those that are at risk of homelessness. So this is if you have someone who's fallen a month or two behind on rent because something came up, an expense that they weren't expecting. They fell behind. All they need is a month or two of a back rent, and then they'll be good, able to maintain in their housing. That's prevention. Diversion is more focused on preventing anyone from having to enter emergency shelter if it's unnecessary, right? So through some data work, we realized that there are a lot of clients who are entering emergency shelters coming from staying with friends and family, and then they're actually leaving that emergency shelter and going back into that same household with that friend or family that they were staying with before, right? So the goal of a diversion program is seeing, hey, are there any resources, services, mediation that we can provide that would help keep that person out of the shelter completely and remain with that family that they end up staying with anyway. I will say diversion is only used for for households where it is obviously safe for that person to remain in that household. So I just want to put that out there. Emergency shelter is exactly what everybody knows. It's an emergency placement. If someone does not have somewhere to stay that night, it's usually the goal is for it to be shorter term. Transitional housing is temporary housing available for usually 18 to 24 months. A lot of transitional housing these days is targeted to specific populations. Youth is definitely one of them. And it's a program structure that has a little bit more of intensive services than an emergency shelter does. So they stay a little bit longer with the goal of then moving them on to their own housing when they're done with the program. Rapid rehousing, I will say, is very similar to transitional housing, except that all services and financial assistance is provided within their own housing unit. So the goal is to immediately move that person into their own apartment within the community. They're provided with financial assistance to stay there, so their majority of their rent is covered. And then it's wraparound services that are provided in order to help them keep that apartment once their time is up. So it might be connecting them to employment services, to different income sources, mental health if they needed, substance abuse, whatever the client is working through basically to help make them stable in that apartment once the financial assistance is done. Permanent supportive housing is a long-term subsidized voucher, usually within the community, but sometimes it's at a project-based location. And then there's intensive supportive services that are provided. So ongoing case management, someone who's connecting them to different services, again, mental health, substance abuse, whatever basically services that client is interested in receiving. Those are all provided once they're in their apartment, and that is long-term. There's no time limit on permanent supportive housing. And then permanent housing is your standard, what you think of when you think of Section 8. It's a subsidy, but it doesn't have that case management that's tied to it. Next slide. So how does a client that you might be working with access any sort of housing opportunity? So all continuums of care are required to have a coordinated entry system. So the goal of the coordinated entry system, like I said, is kind of that front door. It's there to assess the household, so identify that household's vulnerability. In most COCs, that's looking at, how long have they been homeless? Are there any disabilities? Do they have a connection to family members? Do they have any employment history? Anything like that. And then to prioritize the households that are coming in. So they have placement lists basically for different types of interventions. So, clients that might be referred to a permanent supportive housing program are going to be different than someone you might put into a rapid rehousing program who has income and just kind of needs shorter term assistance to get back on their feet. So with the prioritization, the most vulnerable go to the top of the list for the next housing opportunity that becomes available. And then last goal of coordinated entry is to do that actual referral. So when that opportunity comes up, when a housing authority calls and says, hey, I have 10 vouchers, the coordinated entry system connects those clients to those opportunities. Next slide. Why did we switch to this coordinated entry model? I will say in some COCs, coordinated entry is newer, and some they've had it around for quite a few years. The real reason why HUD pushed for communities to create a coordinated entry system, we all know, I'm sure you guys all experience it in the education and workforce world, there's unfortunately limited program resources, right? And so we really need to kind of triage the clients that we're seeing and making sure that the clients who really need permanent supportive housing are the ones that are getting into it. And then the clients who might benefit most from a rapid rehousing program or shorter term assistance, that's what they're connected to. It's a more effective use of resources, and it's obviously, or in theory, it's supposed to be easier access for persons experiencing homelessness. So instead of having to reach out to 10 different permanent housing providers and getting on everybody's individual wait list, there's one contact for them to reach out to, and then they're connected to the program that they need to be. Next slide. So I just added in, and I'm sorry these slides aren't coming through totally clear. Kyrie, you can feel free to email it out to the group so that they can see all these resources. But I listed this only for the central region, but if you are from another county or you work in a different county throughout the state, you can feel free to reach out to me and I can let you know who the best contact for your coordinated entry program is. So if you have someone experiencing homelessness, needs to get connected to some sort of permanent housing program, in these counties, these are the best contacts for you to reach out to. And like I said, I'd be happy to provide the best contact in some of the other COCs as well. Next slide. Yep, I thought so. So that is it for me. I don't know if there's any questions. Otherwise, you can feel free to email me if you don't have a question right now, but you think of that.
If you can back up that one slide, the one before, please. I think, well, not there. Go back to the agencies. There you are. The coordinated entry, I think, is the most important because it gives the individual an opportunity to start working with one group that might be able to direct them to the right locations. So that's the Coming Home, the affordable housing, the Mental Health Association over in Monmouth are all, wonderful. So thank you.
Casey, you want to share your question? Okay, Casey's question is basically asking for the entire state. What we'll do is we'll coordinate with Caitlin and we'll send that out to everyone who's attended. So if you want to be certain you get it, please put your name and either your email address or your affiliation in the chat box and we'll be able to track you down that way. So thank you. Any other questions for Caitlin?
Thank you.
Well, thank you so much, Caitlin.
Thank you.
Okay, it sounds like somebody has something. Nope. Well, thank you so much, Caitlin. Appreciate this, the clarification on the point in time and the continuum of services, continuum of care, excuse me. Thank you. So another question for you to consider. Each of you there, and this gets to one of the themes of today's discussion. If you were looking for a job, what would you do? Where would you look? Would you look online? Would you contact a government agency? Would you ask a friend? Would you do something other? I don't know if anybody wants to talk about it. Now, when we have Mr. Kurzel later, he'll get into that a little bit more. But we just want you to start thinking about what you do when you're looking for a job. Any thoughts? All right. We'll move from there. And as I said before, when we started talking about homeless youth, Alan Ferrara was the person who came to us and made it as simple as could be. We discussed so many things about homelessness, but just said, we need help getting young people and their families jobs. So that was the genesis of what we're sitting here today. So we thank you all for being here. And Alan, we thank you for your idea. Because without it, God knows how much more discussion we would have had, because it's an important topic. So with that, Alan Ferrara.
All right. Thank you very much. I'm so happy to be here. In my region, Ocean, Monmouth, Middlesex, and Mercer, currently, and it's a very low number right now, we have 3,500 students plus who are homeless. And that number is low because when the schools were on remote education during COVID, we were not able to identify our homeless population. So the most current official number is there. Our area has hovered close to 4,500 homeless students in a given year. So you can see my name. I'm Alan Ferraro up on the screen. I'm the regional director for Monmouth, Ocean, Middlesex, and Mercer counties. It's called the McKinney-Vento program. The McKinney-Vento grant act is a federal act. Phoebe Thomas is our state coordinator for the homeless in students, and we work very closely together. We work also with the county superintendents, the DOE attorneys, the federal contacts in Washington to try to make everything happen for the students. Next slide. McKinney-Vento was signed into law, the legislation for protection of homeless students, back in 1987. It took decades for the schools to figure it out and implement services. And finally, we started to move in the right direction. For the first 10 and 20 years, school districts were having difficulty even identifying the students, placing the students back in school, and or giving them services. And when you called another district and tried to explain we had a homeless student from their location, they were reluctant to even pay or acknowledge that they had to pay certain bills such as transportation and or tuition fees. And next slide, please. Or before we go to the next slide, I also remind the homeless liaisons in each school district. Now, every school district, based on the McKinney-Vento Act, has a homeless liaison. And that a homeless liaison, I remind when I do training, that the students and parents who are homeless are on the bottom of Maslow's triangle of needs. They're looking for food and shelter. That's the first thing on their mind. So we have to work with that family and that student in a very supportive way, because employment, jobs, housing are very important to break this cycle. All right, next slide. Now, in each region, there is a regional director like myself. Now, in Bergen, Hunterdon, Passaic, Somerset, you can see it's Diane. So I wanted you to know, in each region, there is a regional person that works with all the homeless liaisons in all the schools. Next slide. Region 2, in our very urban areas, we have LaMonica, and she's excellent. You know, she makes things happen. We had a particular concern working with the Newark schools and another in the Edison schools in my region, 2 big school districts. The problem was resolved within 15 minutes. So it's good when we can connect with other regional directors and work directly with the school systems and their homeless liaisons. Next slide. My region, Mercer, Middlesex, Monmouth, and Ocean. And then we have one more. Next slide. And then down in South Jersey, we have all the regional folk. All right, next slide. And there's our last. Okay, go ahead to the next one. All right, now in Central region that I cover for McKinney-Vento, for the homeless students, we worked along with various agencies, and you'll see that in a second, to do a strategic plan, because we have now extensive amounts of money. The standard McKinney-Vento program grant that comes in, we fund a lot of our agencies in our area to help, be it a homeless shelter, a shelter for domestic violence, school districts who provide extra services, maybe after school programs, before school programs. We do that with one group of money. You see year 3 of 3. Then we received American Rescue Plan money and a second phase of American Rescue Plan money, which was called Homeless Children and Youth 2. So some of the things we started to do, we needed to be creative. What can we do that was different? Next slide. We started to look at a strategic plan, and we worked with Monarch, the group you just saw, doing the first presentation. We said, we need to know clearly who is and who are our population of homeless in our region. We need to know for sure. We then gathered information using also Rutgers, the Blaustein School of Planning and Public Policy helped. And Monarch and the Blaustein group worked continuously for almost a year. And they identified data in our districts and in our region. And they said, you know, maybe what we need is a navigator. Because one of the problems that the school districts had is once they learned how to move the children into school, who's going to pay the bill, Who's going to make sure transportation occurs? Who's going to make sure the child has the right classes and is attending and has school supplies? When all that's taken care of, what's left? The parent needs housing. The parent may need a job. So the navigator basically said to us, or the strategic plan basically said, you need maybe a navigator to help the school district homeless liaisons who have 15 other jobs in the school, which are full-time jobs, and this is just a tack on, help them find the services. So we looked at introducing a navigator. And the navigator we have now hired through the American Rescue Plan funds, one for each of my counties, one in Ocean, Monmouth, Middlesex, and Mercer, one each. And that navigator is now stationed at the CMO, Care Management Organization, in that county. And the Care Management Organization placement was a pretty considered idea. And we placed at that location to be sure that our new navigator was able to understand all the social service components that were out there that could be recommended for service to the parent through the school district homeless liaison. Next slide. So what we started to do is we said, okay, we need the school district homeless liaison to work with the coordinated entry
What about it?
agency for housing. We need to look at the state.
I don't know that person.
We have a few people who are not muted. If you can mute, please.
The unfortunate thing, Alan, is it's associated with no name. I'm trying to track it down.
All right, thanks. So
All right,
using our
find my
navigator
right now.
to help with housing, to help with public and private locations that they can become involved with. And the coordinated entry seemed to be the key, and the Board of Social Service agency in each community or each county seemed to be the location to go to. So the navigator is now helping that school district liaison inform the parents, here's where you need to go for this help. Next slide. The navigator also looked into social service, and we have something unique in two of my counties. We have a New Jersey Integrated Care for Kids. It's a federal project and a demonstration project that is introducing case management and medical coordination for students on Medicaid. We also have an additional grant working with this group for homeless students if they have significant needs in medical, social, eyeglass need, dental, hearing, mental health. They can have services, immediate evaluation at the K. Hovhannian Children's Hospital over at Jersey Shore University Medical Center, and that'll all be free of charge with case management. And so we're looking at all the different services that we can introduce and make sure that the homeless liaison is attached. Now, when I first put this together, and you'll see it's not there, employment. Because when we started doing this a year ago, employment was the next frontier. We weren't even thinking about that. We were still trying to say, where do we help the families go for housing, for services? And when we had our initial discussions with this group, employment is another area that is a major need, but it wasn't on here yet. So this is the next frontier. Next slide. So what we're looking at with the integrated care for kids who are, and those children are on Medicaid, they do a health story, they coordinate what systems they need to go into, they coordinate their medical, they're evaluating, they're looking at social services, and they're then bringing all those providers together with case management and in coordination to a primary provider. And they will help those families and students receive a primary provider if they don't have one. So we're looking at a very integrated model. So if we can start breaking down the barriers to housing, breaking down the barriers to employment, breaking down the barriers to health care and social service care. We're going to start to build a person and family that can be, self-sufficient and maybe break the problem of homelessness and move forward into being a productive person and feel good because they found these other resources. Next slide. Now, in the state, and I mentioned we have each school district has a school district homeless liaison. You can go to that website and you'll find every district homeless liaison in every district throughout the state. So if you need to contact somebody in Westfield or Cape May, you can do that. And also, you can also find those liaisons at the Department of Education web page or homepage. And they have an A through Z. You click H for the homeless area. Homeless pops up. You can click homeless liaison. You'll find every district listed and you can find that person. Next slide. Now, how do we know what we should be doing for homeless students? The Department of Education has administrative code. And in the administrative code for homeless, it explains the definition, the school's responsibility, the responsibility of the homeless liaison, how you make appeals, if a school or district is unhappy with the process, the parental rights that must be given out. So that's all there. And the schools are getting good at this. Finally, it took decades, but they know how to do this. What they have trouble doing still is connecting to employment, connecting to housing for the parents. And that's what we're trying to break down and work on right now. Next slide. Now, in New Jersey, just so you know this fact also, charter schools are considered their own public school district. So if you're working with a charter school or you're working with a student or an employment issue for a student and they're in a charter school, that's their school district. And the only difference in New Jersey is that charter schools receive transportation service from the local public school within their region. Other than that, they stand alone as a school district. All right, next slide. How do you know if a student is homeless? You saw a definition right in the beginning. And the definition coming out of McKinney-Vento, the federal act for homeless students, basically says if the family, the student, is living out of necessity in one of these locations, they are homeless, but it must be out of necessity. Some individuals living with relatives or friends may be a choice. They're living there to save money for a house or some reason. That's a choice. That's not out of necessity. But if a family lost their job, was evicted, they couldn't pay their bills, they had to move in with someone, that's out of necessity. So that's how you start to determine, are they homeless? Next slide. Other out of necessity in the federal act for McKinney-Vento student homelessness is other out of necessity public and private shelters. So if you have a family or student in a public or private shelter, they are homeless by federal definition. There's nothing to figure out. If they're living in a motel or hotel, it could be choice. However, this district homeless liaison must decide, do we have a situation of choice or necessity? Next slide. Other out of necessity would be abandoned in a hospital. And believe it or not, I have one in my region right now, abandoned in a hospital, a student. When we speak at the state level, we have many students who have been abandoned in hospitals. When we give that category, people look and say, oh, it doesn't happen. It does happen. People living in abandoned buildings, and by federal McKinney-Vento definition, if you are evicted, you are homeless until you establish a new permanent residence. So if a person drives up to the school district in a Mercedes and say, I was evicted, I'm homeless, and you look out the window and you say, well, what do you mean? If they are evicted, they're homeless until they establish a new residence. And the only other factor that you consider in the definition for homelessness for students is, do they have a fixed, regular, and adequate? And next slide. And the idea of fixed, regular, and adequate in this definition is a fixed, stationary, permanent, not changing, is a regular, predictable, routine, consistent for the family. Is it adequate? Is it lawful? Is it meeting psychological needs, physiological needs? Is it not out of compliance? It's not overcrowded. So in the same place, it's fixed. Every night, it's regular. If it's safe, sufficient, it's adequate. Okay, next slide. Now, the district of origin, when we're working with the homeless students and families, the district of origin is described as a district where the child became homeless. And that district has the responsibility of determining, are they homeless? Where are they going to go to school? Because they have three options. They can go back to the district of origin where they became homeless. They can go to the school where they're currently, or go to the district they attended last, or go to the school district where they're living on a temporary basis as a homeless family. And you must determine that in conjunction, in consultation with the parent. Districts of origin must have a liaison. They must enroll the child immediately. They must transport the child immediately. They must pay for transportation. They must pay for tuitions as necessary. And the only way those responsibilities will end will be that the family became permanently housed, or they live in a temporary homeless community for 365 consecutive days. Now, the idea of living in a temporary homeless community for 365 days is unique to New Jersey. No other state in our nation has that. That came out of an administrative law judge decision, and school districts who had hundreds and hundreds of these children who were homeless, and maybe they were homeless for 10 years. And a school like district like Newark might have hundreds, and they were paying the bill for 10 years, and they're saying there must be some relief. So the administrative law judge looked at standard attendance law, and in standard attendance law, there's a clause of domicile. And it said if a child lived in, and a family lived in a community for 365 days, that's their school district, they're domiciled there. And the administrative law judge then applied it to homeless and said, for homeless children, you're responsible until they become permanently housed or they live in another community for 365 days continuously without leaving that community. They can move around in that community from a hotel to a motel to their car to a friend back to the motel. But if they never leave that community, they're domiciled there. And that's who's paying the bills. And then parental rights must be given to the parent, and you must do child find, meaning, next slide, that you have to tell the parents it exists. Now, the National Center of Homeless Education, which is a center paid for by the federal government, helps to support knowledge and training in the area of homelessness. They also assist us with attorneys if we can't figure out the answer to a particular appeal or problem. They will give us an answer and respond to us in 24 hours. Sometimes they respond at 11 at night, but it's in 24 hours. And they're very helpful in supplying free materials to the schools, posters, letting people know that the program exists. All right, next slide. School districts have to do child find, tell everybody it exists. They must give written parental notice of all their rights. They must make sure the child's in school immediately. They must recommend to support services. Now, recommending to support services was reinforced again in 1994 in the reauthorization of this program and said you must do it. There's no question, you have to do it. So the school districts were wondering, how do we do it? We don't even know all these support services. So one of the things we started to do in my region, we moved this around the state, was connecting with the Children's Interagency Coordinating Council at the county level, who worked with all the agencies and tried to build training for the school district personnel on a monthly basis. And some counties do this better than others, but there's training about support services. We concentrated significantly in the area of social service supports. Only now, within the last year, did we say, wait a minute, we better make sure they know how to get housing. And then the light bulb went off. not only do we need housing, they need employment. Because without good employment, housing may be a very difficult thing to secure. And that brings us here. And then school districts must make sure that they're telling the other school district in 24 hours, we have your homeless child. And then the district where they came from makes a decision with the parent. One, are you homeless? And two, where do you want to go to school? All right, next slide. Now, when a child shows up as homeless, it starts the whole mechanism of making sure they can be in school, be transported, and be educated. When they show up, they don't have to have in hand their transfer card, their birth certificate, or their health records. By federal law and state code, they can come into school. The only thing that's going to stop a child from being in school is their immunization record. They have 30 days to find that immunization record. They might be coming from out of state or out of country. They have 30 days. If they can't find the immunization record, they are excluded from school until they start their shots over again. So if there's difficulty in getting that done, there's McKinney-Vento funds, there's Title I set-aside funds that can even pay for these immunizations. The school doctor might be able to do it. They can pay the school doctor. But that's the only thing that will stop a child from being in school. Next slide. If a child's records are not here, academic records, they have to be in school. You can't keep the child out. The only thing you can keep a child out is after 30 days not finding the immunization. And during an appeal, we have appeals that go to the county superintendent. Next slide. And the county superintendent has 48 hours to decide this appeal. There might be an appeal of, is the child homeless? Or an appeal, does the child really live in this community? And those appeals will go to the county superintendent. Usually the county superintendent will contact the regional director and talk over the case. And if it's cut and clear and we have code and there's law, it's easy. The decision is made. If it's not that clear, the next step, I might be reaching up into Trenton and saying we need further clarification. If my boss in Trenton can't answer it, we go to the DOE attorneys. And if that doesn't work, we're out to our assistants and our attorneys over at the National Center, and they will respond. And we have one case right now in my region that's going to the commissioner, because after the county superintendent makes a decision, it can be appealed to the commissioner. And what happens there is that the Attorney General for New Jersey will sort out all the information, gather the information, package it, give it to the commissioner's office in the disputes and appeals section, and then a decision is made. All right, next slide. School options, as I mentioned, child's homeless, they can go back to their district of origin where they became homeless. They can go to the last district attended. Sometimes they move around 3, 4, 5 times in the first month. They can go to the district they last attended, or they can go to school in the district where they're living on a temporary basis. Next slide. And any decision on where that child should go to school has to be in consultation with the parent. And then you consider travel time programs, but placement has to be without delay and making sure the child's in school. Next slide. Transportation immediate without delay. Now, we have transportation issues. And you may think it's easy. Well, you send the bus. But busing has been very difficult in the last few years. One, we had no bus drivers. Everybody retired. No one came back after COVID. So busing is very important. And the district of origin is going to pay. And it's going to be their responsibility until the child's permanently housed or lives in a homeless community of some other location for 365 days. And the district of attendance can provide it, but the district of origin or the responsible party pays the bill. Extracurricular activity is also included in transportation if there is a barrier for that child to get there because of homelessness. And the district then would be responsible for transportation. Next. All right, that's it. Now, the most important message here is we finally have the school districts understanding the law and code. We train them continuously. I do major trainings by county. I do individual district training. And the individual district training, I do this continuously. One district at a time. We put in the room a supervisor, a principal, the homeless liaison, the guidance people, the nurse. Everybody hears it, and they're together. And they're all hearing the same message. They've got the idea on what to do. We don't have the fighting about getting the child into school, busing the child, paying the bill, now buying educational supplies, making sure they have an after-school program. We've got that down. Our new frontiers are housing for the family and employment. And those are the things we're going to try to break down. And one of the things I'm actually working on as we speak is for our right here, for our navigators. We're now saying to the school district homeless liaisons, here's a referral form. You're interested in getting this child into integrated care for kids. Okay, check this box. You're interested into for the evaluation, extensive evaluation at the university hospital. Check this box. You're interested in finding other counseling, comprehensive medical, case management, adolescent shelters, domestic violence, employment, housing, food pantries. It goes on and on. Check these boxes. And our navigator now is going to produce that information back to the schools. Now, that might be easier said than done, but that's what we're working on. Our navigators came in place in January. We're into it a month or so. And we're now at the point of refining how we're going to request the information and how we're going to deliver it back. So the coordinated housing entry and what we learned today and going forward on how do we find employment and the right location for employment investigation for that parent or student will be the keys, I think, to breaking the idea of homelessness for the families. You know, we were dealing with the very surface. How do we educate? How do we get them there? How do we pay the bill? But the more important part is going to be the housing and employment. And I think that this starts to opens the discussion for that. So thank you. Gary, you want to take it from there?
Sure. Thank you, Alan. Thank you for the comprehensiveness of that and keeping us all current. And what I'm going to just mention before we move on, if we have your email address, a lot of people have been asking, stop asking, we'll get you a copy of the slides. So everyone should know that. If you haven't given us your email address, please put it into the chat box. Alan, thank you so much. If anyone has a question for Alan, please also look at the chat box, put it there. We'll get it to him. We'll get you a response. We're going to move along. If you were listening to Alan, you should be able to answer this. How many New Jersey school districts do you think have homeless-related staff? About 50, about 100, about 150, about 200. I'm going to move quickly and just say we stopped counting at 213, but if you're listening to Alan, everybody has it. So now we're going to talk about the workforce connection. And, you know, thanks to Alan, I have a different introduction than I was going to use for Kevin. Kevin, yes, is the CEO of the Workforce Development Board of Middlesex County, which operates what's called a one-stop and also has contacts with the business world. He also serves as the president of the Garden State Employment and Training Association, which is the organization that represents Kevin and all of his colleagues that perform like work throughout New Jersey. But my introduction is going to be this. If Alan is referring to this as the next frontier, I don't know if I'm introducing James T. Kirk or Jean-Luc Picard, but we'll stick with the Star Trek reference. And Kevin, the microphone is yours.
Well, thank you for that great introduction, Gary. And I can certainly tell you that I'm not going to be the next quarterback of the New York Jets. So at least we know that. So regardless of how you want to introduce me, it's a pleasure to be here. And I'm glad that we're having this discussion today because there's obviously a lot of connection, as you just heard from Alan's presentation about homelessness, employment, and his presentation, I think, was really focused more on the students who are currently engaged in the school district. I'm going to talk a little bit about many of the students who unfortunately don't get the opportunity to graduate and out of school youth. And that is who our youth program through our WIOA funds serves. We are strictly dedicated to serving 100% of out of school youth within our local area. And so our youth program, we brand it as our elite program, which is an acronym for entry-level internships, training, and employment. And it is currently based out of our Perth Amboy American Job Center, although we do have some outreach services available in our New Brunswick office as well. And staffing for that is basically, it's not a big unit, but it consists of two career consultants or case managers, a program manager, and an administrative assistant. And when you're talking about employment, now this is overall for our program, not just homeless youth, but overall, if you look at our performance numbers, which the U.S. Department of Labor has set certain performance measures for us, when we look at the youth who have gone through our program and who have exited from the program after the second quarter of their exit, we've achieved 131% of our performance number. So we've actually achieved what we have to achieve for our goal for employment. And then our retention is pretty good too, because when you look at quarter four, our employment exceeds our negotiated performance numbers at 124%. So we are above where we need to be. It means that students or job seekers coming through our youth program are obtaining jobs. They're also obtaining credentials. We're 10% above our credential attainment rate. We still have a little ways to go with skills gains. Some of those numbers are still coming in. We're about 77% of our entire goal. So we know that what we're doing is working. But when you talk about homeless youth, we have to consider a couple of different things, right? We've heard a lot of statistics today. And one of the things we also have to deal with, there are a lot of other issues that play into and factors that contribute to homelessness. For example, we know that 29% of homeless youth report having some sort of substance abuse issue or some exposure to using substances, right? So that plays into it. 69% report mental health problems as well. We heard Dom at the beginning of this presentation today share her story and talk about some struggles with mental health. 50% have also been involved in the juvenile justice system. And then we know that lacking a high school diploma or GED is the number one contributing factor for an elevated risk of youth homelessness. And in totality, 30% of people who experience homelessness are younger than the age of 24. I think someone in the chat asked a question, what defines youth? Under WIOA and under our federal legislation, youth is defined for us as between the ages of 16 and 24. So primarily, that is the age range that we're talking about within our program. And again, when you talk about homelessness, it's not just people who are actually as we heard previously, out on the streets, but it could be couch surfing. It could be just an unstable type of situation, which basically then becomes somebody who's identified as being homeless. So I think one of the areas that we're very successful in is that we've built a wide network of resources and partnerships, not only throughout Middlesex County, but through our Workforce Development Board region and really statewide. One of the keys to that has been the connection to our county's Human Services Advisory Committee. That committee has a youth homeless task force. And so we share a lot of information with them. We use them as a resource. They use us as a resource. And it helps us be a little bit more proactive in trying to figure out who within the youth population we can be targeting. I mean, traditionally, we don't go out and try to recruit homeless youth, right? Usually what happens is they come in, a youth comes into our program and we find out usually after the fact that they're either homeless or in a situation that may lead to homelessness. And so the Human Services Advisory Committee has been very integral in helping us build our network of provider and resources that we can tap into. Also, criminal justice partners play a key role. As I said, 50% of homeless youth typically are involved in some shape or form within the criminal justice system. So we also work very closely with our probation department. The county prosecutor's office is very engaged with our youth program, not only from the perspective of homelessness, but just working with our youth program in general. We work with the state parole board. We also work with New Jersey Reentry Corp, and the manager of our youth program, in addition to myself, sit on our county's anti-gun violence task force. And so this gives us insight into some of the individuals who a lot of times are within the age range of our youth program, who we can serve. And we find out a lot of times that in many cases, these individuals who come, who are being served through the anti-gun violence task force, many times are either homeless or in danger of becoming homeless. So because we have so many different resources available, and we have what I would say a very robust network, we are able to meet youth where they're at, meaning that if they come to us in a situation where they are currently homeless, we have a great network of wraparound services that we can offer. One of the things that has also helped us greatly, and this varies from local area to local area, but we have a very good system of communication with our school superintendents throughout the county. On a regular basis, we get a list of dropouts. So we know we can almost engage somebody immediately. If a student drops out of high school, we can engage with them as soon as we get that dropout list and find out, do they want to come into our program? Maybe they left school because of a bullying situation or a mental health issue, or maybe just that type of setting wasn't conducive for them to learn. And so we can enroll them into our HSE program. We also can offer different things in the youth program. There are 14 elements that we can offer to youth, including things such as career exploration, work-based learning. We're hearing a lot about employment, but before we place somebody on what I would consider a permanent job, we may want them to test the waters a little bit and go into a work experience program where we're subsidizing the wage for the individual up to 6 months. And that also gives a certain level of comfort to the employer as well, to know that, hey, they might be taking a risk with somebody who has a lot of other barriers to deal with. And, maybe that employer is saying, well, I'm not sure if I want to hire that person because I'm not sure they're going to show up to work every day, right? Well, we take away that financial risk from that employer by providing work-based learning opportunities, especially through our work-based or through our work experience program. And then we also, within our program, like to weave in financial literacy as well to make sure that people know how to manage their money. Yes, getting a job is very important. It helps stabilize the individual. But if they don't know how to manage their money and they don't know how to budget themselves accordingly, if they did obtain housing, are they going to keep that housing? Because they may not be able to if they don't know how to properly budget and make sure that they are, working towards self-sufficiency. So these are the things that these are the factors that really affect our youth program. And when we're talking about employment, of course, employment is always at the forefront of what we are trying to achieve when working with individuals through our youth program. But I wish I could come on here and say, this is how it is as a group, right, in an aggregate. This is how we are able to serve every youth, and this is how we can get them employment. Because going back to what I said previously, we need to meet the youth where they're at. And each individual that comes into our youth program has their own unique set of circumstances. And so when we work with them, we try to work with them on their each on an individual basis. And for some of them may only need some basic services and get them to the point where we can immediately place them into the job. But others, for example, if they need a high school diploma, we want to make sure that we're meeting that need, and then also concurrently dealing with a lot of the other social aspects of what they're dealing with. So whether it be a substance abuse problem, mental health, we want to try to deal with those and prioritize those barriers accordingly, so that at the end of it, we want to make sure that the person is in a stable employment situation. And I want to go beyond just, it's more than just placing somebody in a job. It's really about getting them into that first entry-level job so that we can get them into a career pathway, so that maybe the first job that they have is only entry level, but hopefully it will lead to a job that will put them on the career pathway that we can work with them moving forward, so that when they're eligible for our adult programs, we can put them into our adult programs. One of the things that I'm looking to build out here in Middlesex County is to create a continuum of service for the one-stop services that we have. Many times people, customers both on the youth side and also on the adult side, will come to us for training. We place them into a job and then we send them on their way and we never see them again. There's no reason why those individuals shouldn't be coming back to us for services, so that we can find new employment opportunities for them, and in many cases through work-based learning experiences, try to upskill them so that we can prepare them for jobs that pay a higher wage and that will get them to certainly to a point of stronger stability and self-sufficiency. So we work in conjunction with a lot of businesses, a lot of employers, and many different aspects of what we do are tied not only to employment, but to the social services that need to be coordinated for youth, not only homeless youth, but for even the youth that may have stable living arrangements. So with that, if anybody has any questions, I don't have a PowerPoint presentation, but I can certainly share with anybody if you're interested in more information about our services. You can certainly reach out to me. I can provide you with our contact for the Elite Youth Program. You can also go to our website, which is mcwdb.org, as in Middlesex County Workforce Development Board. Our youth resources are listed there, as well as all of our other youth programs and programs that we have to serve the residents of Middlesex County.
Thank you, Kevin. The next subject was going to be what's next, but we're running out of time. For you and Alan, just a thought. What about, Kevin, if you could bring your colleagues and Alan bring his colleagues and navigators together and maybe try to hammer out some way for a referral mechanism between the two organizations? Thoughts?
Yeah, I'd love to. And that has actually provided some food for thought for me in terms of one of the discussions I had internally recently, is that although we're serving 100% out of school youth, we're considering utilizing moving forward some of our youth funds for in-school youth as well, because we realize there are significant barriers there and we should not be ignoring that population as well. So I think that would be a good way for Alan and I to get together and talk about how we can frame that out.
And then once they graduate from one of the high schools and they are then out of school, it may be a good connection also for further education. Alan, what do you think?
That's a good point.
I think it's a great idea. And the people up in Middlesex have been always responsive. Wanda Dillon and the people up in some of the social service areas. So yes, we'll make the connection. And I think we can see who's out of school right now, and then we can be ready for some of our needy population who has been homeless to move into some of the services upon leaving school, which is excellent. There was one question in the chat. If I can just, a question came up and it said, who's responsible for paying for transport or education if a child's in a 30-day shelter? If we're talking about a shelter for homeless students or domestic violence shelter, something now that they are in a homeless category, the school district of origin, the district where they became homeless, where they last attended, is responsible for transporting that child back to school. Now, if in some unusual situation that shelter provides education right there, the school district is responsible for paying that bill. But it is the school district's responsibility. Now, if they're in a shelter that's run by, and I don't know if these still exist, the Department of Juvenile Justice, Corrections, that's a different type of shelter. But then the school district works out with that shelter, is that child going to be transported or educated at the shelter? Most times they're educated at the shelter in those instances, and the school district provides instructional materials and pays for the tutoring in most categories. I'm sorry to move away from our topic, but I wanted to make sure I answered that one.
Alan, that's fine. I've put up some related resources that has the website for Monarch Housing, the website that Alan shared earlier for the State Department of Education, Kevin's organization's website and that of the organization he's president of, Garden State Employment and Training Association, if you'd like to reach out to some of his colleagues in other parts of the state. We're up against it now, so I want to say thank you to Alan, to Kevin, to Caitlin, most of all to Dom for having the courage to speak to all of us and share her story. Thank you, Kevin, Alan. We're going to reach out to both of you and try to make that connection, make it a real thing. We'll come up with some more ideas because this is an important and ongoing thing that doesn't disappear after one presentation like this. So Alan will be knocking on your door again, Kevin and Caitlin probably as well. Thank you all so much. Have a great rest of the day. I want to thank Catherine Malone, our chair. I want to thank Kyrie, who busted his butt on putting this together, and everybody else, Alan and his colleagues for getting us the information, Caitlin and hers, Kevin and his. Thank you all. Have a wonderful and safe rest of the day and week. Take care. Bye-bye. All right.